Welcome into To Your Health again, and we have our friend Susan Reed from the Montgomery Cancer Center, and we're going to talk today about things that, I didn't even know, and I should have, but innovations in healthcare, things that are different, things that are exciting, and things that will make your life easier. So let's talk about some of the things that are different now than they were even a few years ago.
Absolutely. So some of the innovations that we're seeing in cancer diagnosing is we might be familiar with very invasive testing, things that take a lot of time to prepare for, like a colonoscopy for cancer screening for colon cancer. Right. There are so many neat tests that are available that are not like your traditional colonoscopies that we might encourage. If you're not having any signs or symptoms of colon cancer, you might best benefit from a blood test that can help us know if you might have colon cancer that would lead to a more invasive test. Or there are kits that can be completed in the comfort of your home that might give us some more information that you might need more invasive testing. So I would encourage everyone to learn more about testing that can be done that's less invasive than we might historically be thinking about for colon cancer screening. It's just really changing and becoming where we can do less invasive testing.
And I think that's good for everybody, frankly. Let me ask you this. What are the most prevalent cancers that we see in older people?
We absolutely see prostate cancer in older men.
Okay.
It's a very, as our men age, it's something to be very aware of changes in their prostate. We see prostate cancer in men. We also see breast cancer in women and men.
And men, which a lot of people don't know.
Right. We do see, so if men have breast tissue as well. So it's important for them to be aware of any changes. We see colon cancer and lung cancer, the most commonly in our community, are the 4 top cancer sites that we really see in our community.
Do you have any idea what the main causes for lung cancer are? We know one thing: if you smoke, please stop.
Indeed. My advice is if it's not air, don't put it in your lungs.
There we go.
And we do see that tobacco use is the most common reason for a lung cancer diagnosis, but it's not something that we can't work to treat. And so I would encourage even those who do continue to smoke, be screened. Talk to your doctor about some options and some things that might help you in identifying a lung cancer diagnosis.
What would you look at for symptoms for lung cancer?
Sometimes if we're coughing a good bit, an uncontrolled cough, or we might see blood when we cough, or just a shortness of breath, or having a hard time taking a deep breath and breathing really deeply, we would very much encourage you to talk to your physician if you see any signs or just pain in your chest. I think it's very important to talk to your physician about.
And the skin cancer, I think, that's another thing. You can, a lot of times when you go for your annual checkup, if you see something that's different, you can have your physician take a look at that. And all of these things are things that can be managed and cured, basically. Where you're not going to have to worry about ever having that back.
Right.
I think that's just so important to make people understand that this is not a death sentence. You can live many years in a good life, and they can take care of it. And does the Montgomery Cancer Center treat all kinds of cancers?
We do. The Montgomery Cancer Center focuses on adults, so we do not treat children because children are treated differently for cancer.
Absolutely.
So we focus our practice on adults, but we have physicians who treat all types of cancer, and they also have strong relationships with physicians in the United States in case a specialist is needed or a trial is needed. But we have very senior physicians, and we have we're continuing to grow with new physicians joining our team.
Normally, is the procedure such that you would go probably to your family doctor or whoever you're seeing, and then you would have a referral? Is that how that
That is most often how we receive patients to Montgomery Cancer Center, is to have a relationship with a primary care physician, a general practitioner, or a family doctor. So if you're having a concern or an issue, you talk to them first, and our local physicians will make a referral to a physician at the Montgomery Cancer Center.
Okay. And I think what we're trying to get across here is be aware that you never get too old to have cancer. Number two, different healthy ways to prevent this: lose weight, don't smoke, eat right, and exercise, right?
And move
And
your body.
And number three, be aware, get treated. It's not a horror show anymore. You know, and right here in Montgomery, I mean, I know a number of your doctors. I have had family members be treated there and friends, and they're absolutely wonderful. So folks, just be aware, be active, listen to what this sweet lady is telling you, and take charge of your health care yourself, because you can prevent that.
Indeed.
You do not have to die from cancer. So we'll stay hopeful.
Indeed, very hopeful.
Thank you so much. Thank you. And thank you for being with us. We'll be right back.